Hello everyone, welcome back to the channel. Today we'll discuss about Spleen decides his life. Keep watching. Here is our MCQ. A 30-year-old man was involved in a motor vehicle collision where he was thrown against the steering column. He sustained a blunt trauma injury to his left upper abdomen. On arrival at the emergency department, he complains of abdominal pain but is hemodynamically stable. Computed tomography CT scanning shows a splenic tear and retained intra-abdominal haematoma. The tear extends to the splenic capsule but not to the hilum. We asked about which one of the following options is not indicated in this case. A. Cross-match, group and reserve blood. B. Pneumovax. C. Explorative laparotomy. D. Serial CT scanning. E. 24-hour monitoring in the high-dependency or intensive care setting. So, if you are new to the channel, please pause this video for a second and just think what are the important keywords here. And by analyzing keywords, try to come to your own diagnosis. Here are our main keywords. His 30-year-old man, motor vehicle collision, thrown against the steering column. These are really important. And blunt trauma injury to his left upper abdomen, hemodynamically stable, splenic tear, retained intra-abdominal hematoma, tear extends to the splenic capsule but not to the hilum. These are our important and main keywords in this MCQ. So this is a classical case scenario of splenic injury, and this is type of a MCQ which is questioned many times in exams. Here the diagnosis is given and you have to know your facts, and using your knowledge you have to work out and exclude answers one by one and come to diagnosis. So, splenic injury is the most common organ injury sustained as a consequence of blunt trauma to the abdomen. Complications in trauma patients who require splenectomy are significantly greater than in similar patients who do not require splenectomy. So, in case scenarios like this, causes of death include sepsis, pneumonia and meningitis. And keep in mind that all splenic injury patients should receive vaccines against pneumococcus and meningococcus immediately regardless of the extent of injury. And in modern surgical care, every effort is made to retain the spleen. And also keep in mind that hemodynamically stable patients require investigations utilizing both ultrasound and CT scanning. Here is a small illustration of splenic injury. So it's graded 1 to 4 according to the extent of the capsule laceration and involvement of the hilum. Grades 1 to 3 are widely considered to be suitable for conservative therapy. So here is 1, 2 and 3. Grade 4 injuries extend into the hilum. As such, they are at a greater risk of major hemorrhage and devascularization of the spleen. And also significant controversy has existed regarding the management of this group of patients. Although evidence suggests surgery can be safely avoided in hemodynamically stable patients using conservative measures. Splenic artery embolization using interventional radiographic techniques can be used if there is a major hemorrhage suspect. This is a little bit to a knowledge. And back to our MCQ. So answer A is cross-match, group and reserve blood. Here there is a risk of major hemorrhage, so patients should of course be cross-matched according to the center's major bleeding protocol. Pneumovax is a vaccine against pneumococcus and meningococcus. So all splenic injury patients should receive vaccines against pneumococcus and meningococcus immediately regardless of the extent of injury, as we discussed. So you must be aware that in 5% of cases of presumed isolated solid organ injury, there exists an unrecognized concomitant hollow viscous injury. Deterioration, peritonism or hemodynamic compromise indicates the need for laparotomy. But in this case scenario, this patient is hemodynamically stable and also the tear extends to the capsule but not to the hilum. So, explorative laparotomy is not yet required in this case scenario. Serial examination supplemented with regular CT scanning should be included. This is a must. And also, in patients being managed conservatively, close monitoring is required in high dependency or intensive care setting. This answer is also correct. The option which is not indicated in this case is C. Explorative laparotomy. That's all about this MCQ. I hope you understood why we came to this answer. Please subscribe my YouTube channel for more important case discussions like this. We'll meet from another MCQ.